Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What to do about apnea and agonal breathing. Respiratory arrest is the absence or cessation of breathing. Respiratory arrest shows up in two different ways, either as a complete absence of breathing, apnea, or as completely ineffectual gasps, agonal breathing. Regardless whether the patient appears to have muscle movement in his or her chest and shoulders, if no air moves through the airway, or just a tiny bit, then he or she is in respiratory arrest. /r/n/r/n. A complete lack of breathing is known medically as apnea. In modern Latin, a means no or not, while pnea means breathing. Apnea can be transient, meaning it comes and goes, like sleep apnea. Or, it can be permanent, such as at the end of life. /r/n/r/n. If the patient is still breathing, but experiencing difficulty such as shortness of breath, it's known as dyspnea, dys as in dysfunctional and pnea as in breathing. /r/n/r/n. Medical texts and healthcare providers sometimes refer to a type of breathing called agonal respirations or agonal breathing. You may have heard this term and wondered what it means. It is a specific type of respiratory pattern and might be mistaken for adequate breathing in an emergency. /r/n/r/n. Agonal respirations are irregular, gasping breaths often seen during cardiac arrest. Agonal respirations do not provide adequate oxygen to the body and should be considered the same as no breathing at all. Sometimes, this breathing pattern is called fish breathing or guppy breathing because of the resemblance to a fish out of the water. /r/n/r/n. In most cases, patients who suddenly stop breathing without warning also suffer from cardiac arrest and need cardiopulmonary resuscitation CPR. Respiratory arrest also can be caused by severe asthma and choking. Cases where the patient is not breathing or has agonal respirations but still has a pulse, are considered in respiratory arrest rather than cardiac arrest. The American Heart Association CPR guidelines detail how to perform CPR during a respiratory arrest emergency. /r/n/r/n. One of the most common causes of respiratory arrest without cardiac arrest seen by paramedics and other healthcare providers is the use of opioid medications or narcotics. It's very important to identify opioid overdoses immediately and act accordingly. As long as the patient is treated quickly, this condition is easily reversed with the use of Naloxone and the patient can most likely recover. /r/n/r/n. If Naloxone is not available to a patient with an opioid overdose, call 911. While waiting for the ambulance, perform rescue breathing for the patient. Rescue breathing will help the patient survive until the paramedics can administer Naloxone. /r/n/r/n. In some areas, Naloxone can be obtained through a pharmacy without a prescription, or through community health programs free of charge. Naloxone only works on opioid substances and the only known side effects are related to reversing the effects of the opioids. /r/n/r/n. When an opioid overdose is suspected, Naloxone hydrochloride should be administered as soon as possible. Naloxone hydrochloride nasal spray is currently available under different brand names, including Cloxxardo, 8 mg/spray, Rixtovy, 4 mg/spray, and Resemblance, 10 mg/spray, which are available by prescription, and Narcan, 4 mg/spray, and Revive, 3 mg/spray, which are available over the counter, OTC. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.